Hello, welcome to this week's staff brief. I'm Paul Robinson. I'm the Chief Executive here at the Trust. And with me, I've got Dave Selwyn, who's our Medical Director and my Deputy. And we've got Helena Clements, Consultant Paediatrician, and she's the Clinical Lead for Climate Action. I never realised how difficult that was to say, Helena. Helena seems to make a regular appearance, and today she'll be picking up a subject of recycling of walking aids. We hope that Annette Robinson will be joining us as well, and Annette will be discussing the leadership support circles and the team leader development programme. So first, I've got some updates I can give, sort of general updates. Firstly, as we always talk about at this time of year, National Staff Survey. So we're a month in, it's week 4, and we currently have a response rate of over 37%. So that means that over 2,000 of you and our colleagues have completed the survey. Thanks to everyone who's done that. Corporate division are in the lead in terms of completion. And with a response rate of just in excess of 50%. As you know, we have a divisional focus each week. Last week, our focus was on the urgent emergency care division, and look out for this week's bulletin where we'll be sharing the results and winning teams with you. And this week, we're focusing on a division of medicine. So please make sure you have your say. Please make sure you complete your staff survey and help your team be the best or most improved of the week. It's really important that you have your voice in how things work here at Sherwood. So really grateful if you could take 10 or 15 minutes of your time. It took me 10 minutes, I'm glad to say, to complete the staff survey this year. So we really need to understand from you what and learn what's working and where it isn't, and what we can do to make things better. Just a reminder, all your completed surveys are completely anonymous and kept confidential. And if you haven't received your survey yet, please email sfh-tr.odenquiries@nhs.net. Moving on to Careflow, an essential upgrade to the Careflow system will take place next Wednesday. That's the 9th of November, and that will be between the hours approximately of 6 and 10 p.m. in the evening. Please ensure your business continuity plans are in place during this time. All colleagues are asked to ensure that PCs, laptops are switched on when you finish work, if you can possibly do that. And if you are a service or department that is operating overnight, please ensure that you close Careflow before 6 p.m. and refer to your business continuity plans. If you've got any questions about the upgrade, please contact Jackie Lynham. She's the Medway PAS manager here at the Trust and can be contacted at jackie.lynham@nhs.net. And I'm hoping that Jess in the background can post that in the chat. Okay, thank you. And I noticed, Helena, that you've been joined by Deb Kerry. So welcome, Deb. For anyone who doesn't know Deb, she's a senior physiotherapist and actually lead for walking aid recycling. So I'll hand over to you, Deb and Helena.
So just by way of introduction, thanks very much for joining us, Deb. As Paul said, I keep popping up, and I'm really wanting to keep climate action and recycling and energy savings in the forefront of our minds over the next weeks and months. So I'm sure you'll see stuff happening in your screensavers and in Team Brief. I've certainly learned some interesting facts about MEMD and the IT department, and I think they've learned things themselves. Quite often people haven't actually thought about it, and then when you ask the question, actually we're doing really well with this. So I think that's really exciting, and I want to build on that over the next few weeks. The walking aids recycling, Debs has put an enormous amount of work into this. It's a national programme or a directive, but she's grasped it with both hands, or even both crutches and has gone with it and launched it this week. So I'm going to hand over to Deb to talk about the scheme, which is really exciting for us. Thank you.
Hi, yeah. So quite excited to announce that the Walking Aid Return and Reuse project has gone live today. Previously at Kingsmill Hospital, we've not actively encouraged people to return unwanted walking aids when they no longer need them. Subsequently, a lot of these will either end up in landfill or stored in people's cupboards, getting in the way. And we actually purchase over 6,000 walking aids a year just at Kingsmill site alone, which obviously has quite a large financial and carbon cost associated with it. Walking aids is actually in the top 20 of medical device categories for carbon footprint due to the high greenhouse gas emissions from the manufacturing of the aluminium. The Net Zero report has actually set a target of reusing 40% of walking aids by 2025. So we've put a lot of work into this over the last 6 months in collaboration with NHS England. So as from today, what we will be doing is whenever any walking aids are issued at any point in on the Kingsmill site, we want patients to be issued with the information leaflet, which basically explains to them how they can return their walking aids and how the process is with reusing them. So we've got 2 drop-off centres with the volunteers are very kindly helping us in the main reception, and we've also got a drop-off down at Clinic 10 Therapy Services, so people can return the aids to whichever is the most convenient location. They're then going to go through a process of being safety checked, of being cleaned thoroughly, and being refurbished if they're appropriate to be safely reissued, and then they're going to go back into our circulation. So hopefully that will have quite a big cost saving from not having to buy new walking aids, but also quite a high carbon saving as well from not having to manufacture more of them now. All 3 sites of the trust, Newark, Mansfield Community and Kingsmill, we're all registered now on the Recycle Now website, which is a postcode locator basically, so people can type in their postcode onto the app. And it will tell them where their closest drop-off locator is. So they don't necessarily have to return them if they've got them from Kingsmill. They don't necessarily have to return them here. They can actually return them to Mansfield Community Hospital or also Newark Hospital if that's closer. So yeah, so that's about it really. Hopefully it's probably going to take a few weeks, I think, really, before we start to see sort of a steady return of them going through. But hopefully, you know, in the next sort of couple of months, we'll get a lot more walking aids back, and we can get them hopefully refurbished and back into recirculation.
I wonder whether I could come back with...
Yeah, please do.
So I don't know whether I can... Oh, okay, thank you. I just wanted to come back with a question to Debs about that, actually, because I was very conscious that my husband had some crutches when he had a leg injury. We acquired a crutch from somewhere, and in the end I did bring them back out of desperation because I kept falling over them. Is there an amnesty, Deb, for all those walking aids that are in people's lofts and cupboards? Can we, so obviously you're working on your new clients, new patients who are being issued stuff. Is there an amnesty to get old stuff back in the system? And the second question is, are we advertising this beyond, if there is, are we advertising it beyond our current patients? Are we doing anything with the local papers or anything to encourage people to bring them back?
So yeah, so this week we are encouraging people to have an amnesty. So we will take any metal walking aids back of any description, wherever people have got them from, however old they are. We're sort of having an amnesty this week to take them back, but that will be an ongoing process as well. We're not going to turn any walking aids away, you know, sort of 6 months a year down the line with it. So people can just return them at any point. You know, we tend to find, you know, people perhaps have a lot of house clearances at times and then find lots of surplus equipment sort of tucked away in the garage with it. I'm hoping that that's going to be advertised sort of via Twitter and via the Facebook page. We're not having any direct comms with any sort of local media at the minute with it, so it's just by social media really with it. But also just to add as well, any of the walking aids that we do deem unsafe for reissuing, there is then a further recycling process with them. They are getting collected at the scrapyard, and then they will actually get sort of scrap metal recycled as well. So even those ones aren't going into landfill.
Keep going, Helena. Keep going.
unmute myself. So that's really exciting, Debs, and I think it goes back to that mantra of can you hear me? Yeah, okay. That mantra of reuse, repair, and then recycle. So very much keeping things working as long as we can before we have to melt them down and recycle. And they will be recycled, as Deb said, if they're unusable. But actually, we can reuse things many times. And you know, you'll have seen the screensaver from MEMD, from the IT department. Reusing stuff has got to be the best way, and that's true with our furniture, and you know, all of the things that we potentially can reuse in the hospital. So I think this is really exciting. One of the next things that the NHS England are very keen for us to do is start looking at some of the single-use items that we use in the hospital and reusing and remanufacturing those. So that will be the next thing that we do in this process of gradually reducing the carbon impact of health services. So this is, and as Deb said, this, you know, the metal walking aids have a very significant impact. What I'd like us to be able to do, Debs, is to be able to report back in 3 or 6 months, say, how that's worked, how many have we recycled, what's the carbon impact of that, how much money have we saved potentially, although that's not the key thing, but hopefully we'll save money as well. But how many have we managed to recycle? And that will be the measuring of how good our climate action is. And it is hard to measure, so this is something that you can count, which is really I think really important for us to see. So yeah, great. This is a really good initiative. So good luck, Deb, and thank you for all the work you've put into making that get going and launching it today. So thank you.
Yeah, great. Thanks both, and thanks, Debs. It's exciting to hear that the launch of return and reuse is today. We've got a question in the chat that I think you talked about, but nonetheless it's worth reiterating. Is there a drop-off point for walking aids at Newark and Mansfield community hospitals? And I think you said that aids can be returned to all our hospital sites.
Yes, they are. So over at Newark, it's Byron House, and then at MCH, it's the therapy department there as well.
Thank you. And just going back to a couple of points that Helena made. So those with walking aids already in their house, if we're issuing 6,000 walking aids per year, just imagine how many walking aids are out there in the community that you know the amnesty would be able to pick up. So I think probably have a conversation with a couple of people about the communications channels we're going to use on that. And to see how successful that can possibly be. And then the other thing I wanted to pick up with Helena is certain irony around falling over walking aids in your house. So I think you need to be undertaking a few risk assessments, but there's an irony assessment to be undertaken as well there, I think. So thank you, Helena. Thanks, Debs. Really exciting, and as Helena said, we will hear some updates as we go on the success of this. Because no doubt, you know, we're going to try our very best to ensure this is extremely successful and give you all the support that you need, Debs, in doing so. It's really important. So thank you very much. Thank you. We did expect to be joined by Annette, but I think she's having a few connection problems. So we'll move on to something else that we talk about quite often on staff briefs, and that's flu and COVID vaccinations. So we're continuing to encourage colleagues to receive both of these vaccinations. Thank you to everyone who has uptaken their vaccination so far. So we know that something like 35% of you have had flu jabs, but we know we can do better on that. We're below where we would normally be. I must give a shout out to the Women's and Children's Division who have the highest uptake so far with 44%. We talk each week about where you can get your flu vaccination, and that's dropping into the clinics that hopefully you're on screen, and also talking to peer vaccinators. They're on most wards at Newark, they're on Minster, and they can also provide you with with the flu vaccinations, and you can book appointments for either vaccination via some links that Jess will put in the chat. So Dave, I'm going to pause there and invite you to sort of give some messages around the importance of this, and perhaps I'm hoping you can paint a picture of the rising number of community rates for both flu and COVID. So over to you, Dave. Thanks.
Sure. Well, at least I know what you're going to ask me. Helena, I'm sure will chip in almost certainly. I think what I would recognise first off is we've all got a bit of vaccine exhaustion and vaccine fatigue, and that's not just amongst our colleagues, that's across society. I think the messages I would just put out to people are that we've seen a very significant skewing of our traditional viral seasons. So traditionally, we knew when some of the childhood illnesses were coming in, we knew when some of the flu seasons were coming in, and of course since then we've sort of been slightly stymied by COVID, and we are now in the recognised fourth COVID wave within the NHS of this year, and that's because the COVID virus continues to evolve. It's a tricky little thing, and we're now on BA5, which is the circulating variant at the moment, which is quite a nasty one compared to some of the others we've seen. And for us as an organisation, we've still got just over about 110 patients within the organisation who either have active COVID or who have had COVID fairly recently, and that Nottingham and Nottinghamshire does seem to be a bit of an outlier in this, that we're seeing higher numbers. Some of that may be just with our detection rates, but we haven't seen, certainly in Mansfield and Ashfield, we haven't seen our numbers go right down completely, and we for a number of months we've been bubbling around the 90 sort of patients either well within the organisation who've had it. Now we've bumped up for that. So I would just encourage everyone who possibly can to get themselves a COVID vaccine. It's a bivalent vaccine that we're administering. We started off with Moderna. We're now currently giving the Pfizer bivalent vaccine. So that means it's active against the original COVID variant and the more recent variants that you've heard talked about in the press. Having said all of that, I was really going to just concentrate on flu, because we do sometimes sort of get a bit distracted by flu, and one of the things that we've noticed, we've been watching what happens in our in the healthcare systems in other parts of the world, and we usually follow the flu season of what happens in Australia or Australasia, and they got a very pronounced flu infection rate particularly across the community and across their hospitals, and it was very early in their season, so we're sort of anticipating that we'll see a lot of flu quite early this year, and so we're just into November. We've got around about 5 flu patients currently in the organisation. We've actually got an outbreak on one of the wards. We have got one patient who's got joint flu and COVID. But this flu is not, in most people it is a relatively minor condition, but of course in some people it isn't. And I've got a background in critical care, which means I'm a bit sad and perhaps a bit warped. But I do remember well, we all have patients that we carry with us. I remember well a 50-year-old man, looking after him on the critical care unit a few years ago now, and he was fit and healthy, and he came in with flu, and I couldn't save him. Everything we tried to do with him, he obviously was on a ventilator, he developed multiple organ failure, he was desperately sick, and I had to get his teenage children in who stood with me and him as he died. And you know, I carry that, but flu is not a simple disease in everyone, and so we hope that anyone who has flu, it's relatively simple, but the best thing you can do to protect yourself is to get a flu vaccine. And so we've got the quadrivalent vaccine currently around at the moment, which again we think is the circulating types that we've got, mainly H1N1, and the worry to us as planning for our winter is that we haven't seen much flu for 2.5, 3 years or so. So we're relatively immune to flu. We've not seen it circulating in the community. So this is why we anticipate that we'll get really quite a big impact this year. And of course, it's beholden on us. It's a key component. COVID vaccination and flu vaccination, a key component of our winter plan to try and minimise attendances at our organisations to try and help keep our population safe. But it's also, there's something there about us taking a bit of ownership for our own personal health care, and getting vaccines, getting the COVID vaccine, getting flu vaccine is something that we can do to minimise our risks of being unwell. And then just finally, on the sort of infectious diseases, the other thing that we again are anticipating and just starting to see is something called respiratory syncytial virus, which is traditionally a viral illness seen in children. And it comes, Helena was telling me this morning, comes around this sort of time of year. But again, that's been skewed quite a lot. And watching what's been happening in America, they've seen multiple viral seasons, if you like, out with what they normally have of this. And that puts tremendous demand on our paediatric services, and often our paediatric intensive care services. So I think that my message really is to just encourage anyone who possibly can to get a vaccination. You can have your COVID vaccination and your flu vaccination at the same time, or you can stagger it. It's entirely up to you. I have mine just because the timings. I have my COVID first, and then I have my flu about a week later. But they will do it both times. We've got around, I think the actual updated numbers, we've got about 37% of all of our colleagues have had a flu vaccination today. That's lower than we would normally see at this time of year, and I think that comes back to the point about perhaps vaccine exhaustion and vaccine fatigue. And you're right, women and children are leading the way with about 44.6% of their workforce have been vaccinated. But I just strongly encourage anyone and everyone to have a vaccine. I don't know if you wanted to comment on that, Helena.
Yeah, thanks, Dave. And I would echo what you've said. You know, sadly, because I look after particularly vulnerable children with neurodisability, or I did until recently. Flu is a real killer for that particular group of patients, and the RSV is also, as Dave said, this virus that really picks on very small babies. I suppose I just wanted to add that over the years, I probably wasn't very good at getting my flu vaccine when I was a young doctor, partly because I never thought it would, it would just be a cold and I'd be fine. And it was very much about the impact of flu on me. And what I would say is, over the years, and particularly as I've become more of a medical manager, I've realised partly I've seen what it does to my patients. So that's absolutely our priority, isn't it? But also what it does to teams when you've got a flu outbreak amongst colleagues, and the impact that has. You might be off with just a cold, but actually the impact it has on all our teams and staffing is really significant as well. So it has multiple. For me, there's multiple reasons why it's absolutely essential that I have the vaccine. And I don't think I'd really joined all those dots together until the last 5 or 10 years, but I'm there at the beginning of the queue these days because it's so important. So yeah, everything that Dave said I would reiterate, and I think it's hugely important. So yeah, go and get it.
And yeah. Again, the other thing I've been reminded in the chat is that it is available for children via GP, and we can administer this via now a nasal spray as opposed to a needle. So technology is fantastic, but you can also get your children protected.
Yeah, really important. Thank you.
Yeah, thank you. Really powerful stories and advice there from Dave and Helena, and another. We've had a comment in the chat from someone who's anonymous, and I think they're referring to the critical care story, Dave. After hearing that, I'm now booking my flu jab as soon as possible. It really made me think. So hopefully, people will hear the message loud and clear. And you're quite right. Someone gave us some advice around the vaccinations for preschool age children, so I'll just post that as well. Just a reminder that for everyone who does receive their flu vaccination, you'll also be given a free meal voucher, so you can use that in the Spice of Life restaurant and also be entered into the monthly prize draw. So further incentive there if Dave's story wasn't sufficient. So thanks Dave. Thanks also Taylor for adding to that. I'm really pleased that to see that we've been joined by Annette. Annette, you must have had some connection problems, but we won't dwell on that because I know that you're really busy today, so you're squeezing us in. I know we mentioned this last week and you wanted to come and talk about the leadership support circles and the team leader development programme. So without further ado, I'll hand over to you.
Lovely, thanks Paul. Yes, I'm finally in the room, so I'll share my slides with you. Hopefully you can see those, if somebody can give me a nod. Can you see that? Yeah, marvellous. Okay, so I'm going to talk about the leadership development offers that we currently have here at Sherwood, both internally and externally. So we've got a wealth of leadership development offers and they're for people at all different levels in the organisation. So I'm going to start off with the team leader development programme. We have 2 cohorts per year. We take those they start in February and July, and they're for new or aspiring supervisors, managers and team leaders, anybody that leads a team that leads people. That's a 6-month internal programme of 6 study days. There are essential tasks to do in between the study days. There's also an online discussion forum, and there's the 1-day CUSA fundamentals course to attend as part of that programme. And at the end of that, staff then do a service improvement project in their own area. And that programme builds internal knowledge, skills and behaviours, helps you develop yourself and lead your team, and creates local networks. That application window is currently open. It closes on the 13th of November, and that's for cohort 10, which commences in February 2023. So details about that are on the Leadership and Management Development intranet pages. So currently open until the 13th of November. We've also just opened the Mary Seacole local programme, again a 6-month programme. That's 3 workshops which are virtual now, 5 to 10 hours online learning per week, quite a lot of online learning there. Again, reflective journal, discussion forums, and there is a 2,000 word assignment at the end. People do need to be either a new manager or leading a team, because there's sort of like things to do in between the workshops that you need to be doing practically with your team. It is a local programme with our ICS partners. It's £150, which the director or the individual would need to fund. That is in comparison to £995 for the national programme, and that's because we run that locally. We've got facilitators trained locally, and we've got the licence to do it with Knox Healthcare Trust, NUH and the City Council as well. So applications close on the 11th of December, and those cohorts 16 and 17 will commence next April. And the applications you really need to make sure you send them back to the right place, because if you send them back nationally, you'll have logged yourself in to join the national programme, which again, like I say, costs £995. So really need to make sure you send your application to the correct place for the local programme. We've got the Charter Manager Degree Apprenticeship, which we support in the organisation. That's at level 6, so that's degree level. This is with Leicester de Montfort, and there is a webinar on the 9th of November to book a place. I will put this in the chat box as well. You do need to book a place. It doesn't mean you have to, enrol for the programme. It's just to get the details and to understand what it entails. So it's a 3-year programme of 12 modules plus a work-based project. The modules are delivered in 2-day blocks, and that is attendance at Leicester, and they're about every 4 weeks. 15 hours of study development per week, which includes 20% off the job learning. So that doesn't mean you just purely do the study, etc. You do learning sort of like within the workplace, but not actually sort of like on your current job. So it is development for you. You do develop an ongoing portfolio of evidence, and there's an endpoint assessment, and applications are currently open until the end of January for the April 23 intake. So again, if you're interested, book onto that webinar to get more information. And also as well, there will be information on the apprenticeship pages of the Learning and Development intranet site. We also support level 7, which is master's level. That's systems leadership and also senior leaders apprenticeships with Arden University. This is a new university we've just taken sort of like as a provider, started using, and had really good feedback from. We've got about 5 people in the organisation on these apprenticeships, and really good positive feedback from them about the experience with Arden University. So they take 2 intakes per year, April and October, and the application deadline for the April one is the 3rd of March. I think that's currently open now. Look out for webinar details. I will be putting those on Bulletin, and I'll also put them on the Leadership and Management intranet page. Again, they sort of like, you get far more information about the programme. It is a 3-year programme, again some compulsory modules and a final work-based project at the end. That work-based project really is the dissertation part. Again, 15 hours approximately per week with 20% off the job, and again an endpoint assessment where you have to have developed a portfolio to say this is how I've developed as a senior leader. And then finally, leadership support circles. This is a current offer we have internally within SFH, and these are a series of 14 evidence-based behaviours which can help managers, leaders, supervisors sort of support themselves, because the evidence is if you support yourself, then you can support your team better through challenging times. And these are the 14 themes. Today we've got a full house. Today is the 3rd one, set the emotional tone, and that's about sort of like emotional intelligence and how you respond to things, how it influences your decision making, your problem solving, and how you actually sort of like it can enhance your resilience, and going into this winter, etc. Be really important, all of these behaviours there. They are every Tuesday from 1 till 2:15. This is the 2nd round that we've run within SFH. You book them via the online course booking system, and some of the themes are ICS partners, NUH, and Notts Healthcare Trust. They've picked out 1 or 2 themes, and so we have got the facility that if you miss one of these from Sherwood, you can join on to the NUH or the Notts Healthcare Trust ones, but they're not running all 14 like we are. So really good positive feedback from the people that join. It's a safe space for people to explore what's happening for them currently. It's to get a bit of information about the actual topic. So today, as I say, is about emotional intelligence. Then you go into a breakout room and you have discussions with colleagues. And some of the feedback we've had is that people have spoken to people within the trust that they never would have gotten in touch with or never spoken to from a work basis in their daily role. So they've created networks and understood what sort of the pressures are for each other currently at work. So they're really proving popular at the moment. And then finally, we've got all our wealth of toolbox talks, etc. And these are for staff and for managers as well. But what I would say is we publish these every year. These all went out last year. They've been out every year. We went round in the height of COVID and delivered them. And what I will say though is we are refreshing the offers for 2023. So if there is something that you think as a member of staff or as a leader and a manager that you think we need this as a development, etc., we need this bit of training, it'd be really good to have something, then please talk to us, because we can look at building that in. So, and that's it, Paul. Thank you.
That's great, thank you. So I've got a couple of questions, if I may, but before I do that, Carolyn Harris has sort of clarified some of the conversation about the apprenticeships and the amount of off-the-job training, because it's changed recently. So it looks like that. I'll post it in the chat. It looks like that the maximum is 6 hours per week, or 20% of your weekly hours, whichever is the greater. So looks like that's changed recently. I'll just publish that. So thanks for that, Annette. I was interested in understanding how many colleagues we do have that you support through the apprenticeships and other opportunities that you suggested, that you talked about today, but also what those individuals have achieved as a result of undertaking those apprenticeships and other learning opportunities, because I know you support them beyond that. So is there any sort of insights you can give for somebody who may be interested in and what it might give to them?
So we've had about 50 to 70 leaders go through the apprenticeship programs, senior leader apprenticeship programs. We've still got some currently on those programs, and for some of those leaders it has led to career progression for them, certainly widened their thinking, their critical thinking, and how they sort of like their decision making at work, etc., and also responding sort of, you know, to challenges at work as well. And something that somebody said to me was it's changed their language, how, you know, from a strategic level perspective, and it's changed their language when they're talking in meetings because they think differently now. So that's from a senior leadership perspective. We've got about I think about 5 or 6 people on the chartered manager degree just about to go through the endpoint assessment, and again for some of those it's led to career progression. For some people they've actually changed roles. I was talking to somebody yesterday who's moved from sort of a non sort of clinical role and has moved now into an operational manager role perspective. So, you know, it can lead to different things, etc. And there are apprenticeships right across the board, apprenticeships that are specific for clinical jobs. There's apprenticeships for admin, business, clinical ones as well. So there's a wealth of apprenticeships, and Carolyn Harris would have lots and lots of information about all the different apprenticeships. But what we also do from a leadership perspective, anybody that's been on a team leader program, Mary Seacole, or an apprenticeship, a leadership one, I track their career progression now to see whether, you know, what has it done, you know, has it helped them from a career progression perspective, etc. And we were looking, and I think there was something like 48% had progressed in the last 2 years from undertaking leadership and management development training, be that team leader, be that apprenticeship, be it a Mary Seacole national programme, etc.
Well, that's brilliant that you know, it proves to be that useful in terms of career progression. Yeah. And hopefully, you know, those that haven't used it for that have, by the sound of it, received lots of benefit in the way that they now think and can contribute to the trust. So maybe we can hear some stories from individuals who are willing to tell those stories to encourage others to get involved.
Yeah. Okay. Thank you.
Thank you. So thank you for that. So we've come to the end. Has anyone got any comments that they'd like to share more broadly? Dave usually has. It looks like he's shy today.
Yeah, I'm on my best behaviour. I don't think I've got anything more to add to what I said, really. I mean, you know, I clearly carry very strong reasons for advocating flu vaccination and those sort of aspects, but of course, you know, there's a reason for this, that people do come to harm from these diseases, and we sometimes forget that.
Yeah, thanks, Dave. So I think that there is a question in the chat that I'll come to in a moment. for you, Annette, there's something about someone's posted about they're really interested in hearing about further training, and I'm just about to publish the contact details for Carolyn Harris, who can provide it. So there, and also in the chat there's lots of links and for you to make connections to a number of the topics and people that we've spoken about in the last 40 or so minutes. The question, Dave, is for you and I. It's the 1st of November today, and therefore we're marking the start of Movember, and someone's curious about whether both you and I will be growing a moustache during the month.
Yes, I saw that. Well, so I have done this before, and I have to say Mrs. Selwyn wasn't a fan of it, to be fair. And the other thing was I seem to grow grey hair, which also confused me a bit. But I did have a shave this morning carelessly, but maybe I need to think about that. I'll follow your lead, shall I, Paul?
Yes. Okay. Well, we'll discuss that on the corridor. And don't shave carelessly. That can lead to all sorts of problems. Okay. So thanks for joining today. Thanks for Debs and Helena updating us on return and reuse of walking aids and the recycling initiative that's taking place. Thanks to Annette for taking us through the leadership development program and also that leadership development circles that people can access, and signposting us to the Toolbox Talks. And thanks, Dave, for your powerful story about why flu vaccination shouldn't be taken lightly, and we should take flu and COVID seriously. So thanks for joining. Thanks to everyone for getting involved on the chat and for their encouragement to Dave, because growing a moustache is for a good cause. It doesn't depend on whether you're grey or not. So that's all to look forward to at the end of the month. We'll get Dave back on at the end of the month just to show what he's been able to produce, and he's already looking forward to that. So thank you to everyone. Hope everyone has a good week. We'll see you again next week. Goodbye.
Thanks, everyone.